Hello, and welcome to Essential Oils for Health and Wellness. My name is Dr. Kelly Cloonan, and I'm so excited to share with you guys today how you can use essential oils to support a healthy lifestyle and wellness for a lifetime. So excited to share with you guys today. So, what are essential oils? This is a question that a lot of people really just don't know. But they're plant materials that are steam distilled or cold pressed to release the essential oils from the plant. So it's extremely concentrated. So for example, the NIH states that it takes 220 pounds of lavender flowers to make 1 pound of essential oil. So essential oils have different chemical compounds depending on which one it is, and different uses of how it could help you. So these are some things that it's distilled from or cold pressed. Typically, fruit is cold pressed from the rinds, but flowers, trees are distilled. Oils have historically been used for mind, body, and spirit. They've been found to reduce stress, nausea, pain. Some have been found to have antiviral and antimicrobial effects. Oils can be really used to support every area of the body and really support your journey to health and wellness. It's awesome how it can really assist many of the different body systems, again, depending on which oils you use. So how do you use essential oils? So there's different traditional ways that different countries use essential oils. So the English apply them topically, and this is one thing I want to share with you is ensure to dilute your oils. I just explained to you 220 pounds of lavender for 1 pound of lavender essential oil. It is highly concentrated material, so you want to dilute. So I have a free dilution chart there at that site listed with some resources. So you want to check that out for a free dilution chart. It's really helpful. And then the French ingest oils. This isn't often something that's done in the US. It's not encouraged as much as the other methods, and you really have to be careful when you ingest oils. So it's just something to be aware of. Topical use of oils really hasn't been found to cause many issues. So when people apply them, and if you're new to oils, don't be afraid to use them, but know that if you apply them topically, there's really minimal risk to using those oils. So it's kind of nice because you don't have to stress. Whereas if you ingest, you really need to know what you're doing. And diffusing is a great way also that's fairly safe. There's some oils you want to be cautious with animals and, around young children, things like that. But this is when you inhale the oils. And this is really one of the most, I'd say the most effective way to get oils into your system. It's awesome. Grab a diffuser, your oils, and enjoy. So one thing to consider, you want to use caution when purchasing oils. When I did my research for my DNP project, I found that some places use really scary water and gross things that you don't want to know, or they use pesticides on the crops so that they could distill more crop. Because obviously if you're using pesticides, you're going to get more of a crop to then distill into oils. So you want to find something that isn't using pesticides, a company not using that. Chemical solvents are also sometimes used to extract a greater amount of oil. So it pulls more oil out of the plant. Again, a lot of things that I try to share with people is swapping out toxic chemicals for essential oils. So if you're swapping out something, for a toxic chemical, for a chemical solvent that was used to extract the oil, you're really not doing yourself any benefit. So a pure essential oil only needs to contain 5% of oil to be considered pure. This is what our standards are in the US. So this is where I say you have to be so cautious. Lavender essential oils are the #1 most adulterated oil. So it's actually commonly adulterated with another plant called lavandin, and there's other things too, like I said, the chemical and pesticides used. So you have to be very cautious. Just do some research, trust the company that you use, ask how they get their plant products, the oils, are they the ones distilling? Find out some of those answers prior to just grabbing them off a shelf and saying, oh, I'm going to use this essential oil. Keep in mind that it may not actually be pure if it says it is. So just be cautious with that. So I wanted to give you guys some day-to-day tips. How do we use oils? How do we use them to reduce stress in our lives and different things? So this is my Help Me Relax complementary therapy with then the use of essential oils tips. Okay. So Regular exercise is really important for relaxation. So, though I love oils and I think they could do a million different things, you still need some of these other things in your life to be able to relax and live a healthy life. Regular exercise, healthy diet, limited caffeine can actually help you relax better. Limited alcohol or refined carbs, all those things kind of speed us up and make us feel more flustered and chaotic. So, those are great things to reduce so that you're not feeling that way. Practice deep breathing. Do this every hour if you can. Take a few moments to take some great deep breaths. Do that, when you're done with this presentation, take a moment to do that. Take up a hobby, something you enjoy. Take a day off, take a vacation day. You need time to rest and rejuvenate your body. So essential oils can help relaxation by actually having a pharmacological effect. It's not just mental. It triggers a response through the olfactory limbic endocrine system. And so I'm going to show you here some oils that are great for relaxation. Bergamot is my personal favorite, mostly because I'm always on the go. And this one is one that relaxes you, but is also uplifting. So it doesn't make me feel tired and want to go take a nap. It makes me want to take deep breaths, relax, but continue to go about my day. Roman chamomile, clary sage, frankincense, lavender, melissa, neroli, sweet orange, sandalwood, tangerine, ylang ylang. So one thing to say, too, if you're pregnant, you want to look into any oil you're putting on your body. I always suggest using extreme caution when pregnant. There's some resources out there that could help you with that. So keep that in mind. For example, clary sage might be one you don't want to use when you're pregnant. So just consider that as you're listening to this. If you are pregnant, there's some great oils you absolutely can use, but you want to just look into that prior to just saying, I'm going to try this. So oils to wake you up. I think of this as supporting health and wellness because as nurses, we are on the go, whether we're working in education, on a nursing unit, we're in a leadership position, whatever we're doing, we need stuff to wake us up sometimes and give us a little bit of that energy and focus. So these are great ones for that. Basil, black pepper, ginger, lemon, lime, geranium, rosemary, peppermint, pine, thyme. And if you listen to some of these, a lot of these are just ones that ground you, but also give you that little bit of just uplifting sense. It's not one researched that's on this list, but orange oil is another one that I would add that for me is one of those personal ones. So this is part of what I want to share with you about oils is it's a lot of trial and error. There's going to be an oil that you're going to be like, oh my goodness, this gives me so much energy. It makes me feel so good. It makes me have a really positive day. And for someone else, they might be like, ugh, can't stand the smell. So it's a little bit of trial and error. Just because you try an oil once, don't give up on it if you didn't like it. I love to mix lemon, lime, and orange on like a Saturday morning to get me really going and cleaning or, getting things ready for the weekend or whatever it is. So that's a great thing. I put on here a great study and focus blend because as nurses, hopefully we're always growing professionally. So hopefully you're studying for some type of certification or an advanced educational program or just doing your continuing education units. But this is a great study blend, peppermint, lemon, and rosemary. There's some studies on this, and I'm going to share with you guys at the end some resources that you could use to look up different things. But the NIH has some awesome studies, and also PubMed where you could look at this. And so these are ones that were found to provide more accuracy when people were entering data or help with a test. So one thing to do with this, so that's very important, especially peppermint in particular, there was a study linked with this, that you need to use peppermint when studying and then also when taking the test. It's helpful in that way. So these are great ones. And then again, diluting with that carrier oil, you want to check that out. You could use other dilution charts, but make sure it's safe and use something that you're diluting these oils. They are powerful. And really, you don't want to waste your oil. It's not necessarily, some of them might be harmful to use in large doses, but for the most part, you're just wasting it because you only need a little bit. A little goes a long way with this. Supporting your immune system. I think this is so important for a healthy lifestyle, not getting sick constantly, not being, in bed and missing work or missing activities of our lives and, missing events. So essential oils support and strengthen the immune response by directly inhibiting the microorganisms and stimulating the immune system. So it's awesome. And there's again, some studies on this. And these are ones that do both of those things. So they inhibit the microorganisms and stimulate the immune system. Eucalyptus, lavender, lemon, oregano, rosemary, tea tree, and thyme. Love those oils. I use all of those almost every day. I do an immune support roller where I blend together different oils and then put them on my body, my kid's body, and we rarely get sick. When I don't do those things, I did have a season where we had moved and I was not as consistent and we got sick several times. And I've been using oils about 4.5 years and I was like, huh, very interesting that those couple of months of transition where I wasn't as, set with doing it, we got sick several times. So I strongly believe in oils helping support your immune system. So I have some resources here for you, and I do want to say some of these do have affiliate links or memberships to sign up for, things like that. So keep that in mind as you look at these, but these have great free resources. Every single one of these things has something on there with a free resource. National Institute of Health, great place to go. This is when I was in my DMP program. I did my focus on nursing knowledge of essential oils, and I pulled probably 90% of my information from the NIH, articles on the NIH. It's an amazing site. So the National Institute of Health, and then from the National Institute of Health, they have this National Center for Complementary and Integrative Health. So let's see that, nccih.nih.gov, a couple down, and then PubMed. So a lot of it's all within that same site. It's all the NIH. And so great resources on there, science-based. You could look up research articles. When I first started on this journey, I did my proposal presentation for my DNP. And I was asked this question and they said, well, this is just assume that this might work. There's no science. There is, and there's more studies happening. And a lot of that is due to the National Center for Complementary and Integrative Health. They're pushing for more studies because the truth is pharmaceutical companies drive a lot of the other meds that we use. So that's why when some people are like, well, why aren't there more studies? Well, who's paying for it, right? So that's why I love NCCIH, that they're able to, do some grants and things that could get these oils into complementary therapy that we're using. And going back to that holistic approach, you think about Florence Nightingale, she didn't have a lot of what we have today. And a lot of it was more about supporting health and wellness more than just treating disease and illness. And I feel like it's such an essential part of what we do. Herbs and other complementary therapies are awesome. And oils are, just because they're so concentrated, you need very little to support that. And it's practical for use in your day-to-day life. TheMoreYouOil.com is my website. Again, just keep that in mind that there are some affiliate links on there, but there's tons of free resources. I actually have all these resources listed. The free dilution chart. There's some safety videos, and I wanted to share my email with you guys too, which is on the screen, because if you ever have questions, let me know. I'm not your doctor. I'm not your healthcare provider, and none of these sites are meant to replace that. None of this information is meant to do that. But if you have questions, I'd rather you ask. Don't just, I love to say dive into using oils. It's so fun, but you have to do it with caution, just like anything else. For example, your children should not have access to your oils. These should be somewhere up and locked so that they're not using what they want, or, some of the stories, unfortunately, that were toxic doses of oils were when children, before they had the integral droppers, which is the little thing that makes it come out slower, and where kids had drank a whole bottle of an oil. That's not good and can cause, obviously, very awful, possibly fatal results. So these aren't something to play with. These aren't toys. They're to be kept up. There's also some safety things that you can use, keeping in mind citrus oils. If you put them on your body or you're ingesting them, if you go out in the sun, you could get burned easier. So there's certain things. I have some of that I talk about in videos. The NIH has great safety information. And then I also have listed on here the National Association for Holistic Aromatherapy. I love this site. I love this site because they give a lot of information, and it is grounded in science, but some of it is also where I feel like they allow that trial and error a little bit more. It's a little bit more open to, hey, here's what this could be used for. So I love that site. So I hope you enjoyed this presentation. I hope you will check out some of these resources and jump into using oils with caution and use some of what we learned today. And I hope you have a wonderful day. These are just the references I used to do this presentation, which also, again, these are great resources. If you want to check out any of these articles in particular, I think you'll be in good shape to learn a lot. There's a lot out there. There's, it's surprising. And like I said, some people think, oh, this research doesn't exist. It does. There's some great studies and some great evidence supporting things. And actually, right on the screen here, the National Cancer Institute, again, part of NIH. But this cancer.gov specifically is where you could go. There's tons of stuff on there that you could utilize and check out, and it's fascinating, and it's amazing what patients could be using, and just we could be using to support our health without using pharmaceuticals, or in complement with pharmaceuticals. So again, here's just a few more resources. Sorry, it's a lot, but I do want to leave it on the screen a second so you guys can look up these articles and check them out if you have an interest. But feel free to contact me. I hope you enjoyed this presentation. I hope you learned something. I hope you will go and relax, support your immune system, wake up with some energy using essential oils. Take care.